Our active numbers were about 292 with a total deaths of 63. A couple weeks later, we did know at that time that we were seeing more and more of the Delta variant out here and that we were heading for a spike. We did see a spike in Overton County around September 8th. The numbers looked where we had total active in the county of about 411. And our deaths were still at 64. There's good news and there's bad news with this. The good news is you can see our total active cases a couple weeks ago were at about 411. We've now dropped down to 272. We kind of thought this is the trends we've been seeing as we've been moving up and down with cases as you've seen spikes. Unfortunately, the sad part with this is a couple weeks ago our death count was at 64. And now we're sitting at 76 on our death count. We've seen an additional 12 people pass away. This is the way that the virus works. You see cases go up. You see hospitalizations. Unfortunately, then we see deaths as the cases go down. You have to remember, some people, they have the virus. It takes them. They stay in the hospital. They unfortunately do not recover, and deaths occur after you see spikes. We're at least hopeful that we're going to continue to see the case count go down. So with that, how do we combat that? As we've been saying here now for several months, vaccines, protecting yourself, taking other measures as well. Vaccines are our number one weapon against this. We do at the health department and other places across Overton County, you can get a COVID vaccine. It is free. A 2-shot series from Pfizer and Moderna. We do have both of those. Megan is going to discuss a little bit about boosters, third shots, things you've been hearing about in the news. I wish I had a little bit more encouraging news as far as what we've seen on our vaccine count. If I look back here on where we were approximately a month ago, we had about 32% of the 32.78 of the population in Overton County who had at least one dose of vaccine. Here through September 24th, we're now at about 34.37. So what we're seeing is about a 2% in a month's time of the population getting at least one dose of vaccine. We'll continue to try to educate. These vaccines are safe. They've been approved by the federal government, by the FDA. If anyone has any more questions or information, we ask them to call the health department, come by and see us. They've been proven effective. Unfortunately, we've seen breakthrough cases with people who've had vaccines, but very rarely do we see those resulting in hospitalization or death. It's better to be protected, at least have some kind of protection. At the health department, we're open 8 to 4:30, Monday through Friday. You can come get a vaccine in a drive-through status. Most of the time we're doing vaccine. You stay in your car, get your paperwork in and out. We're continuing to see people that are coming for first doses and to get their second dose. So I am encouraged that every day we're seeing a few more people come in and get a first dose. We know they'll be back for a second dose, we hope. I will ask, if you've had questions, if you've been on the fence, please do some research. Talk to family members, loved ones. Talk to your healthcare professionals. Do research and try to get a vaccine to help us get out of this pandemic and head in a different direction. Also, fall is coming up, and with that comes flu shots. And we at the health department, as well as other healthcare providers, will be offering the flu vaccine. Last year, you probably heard less about flu disease than any year we've had in recent history. And before this time, last year we were talking about what's going to happen when we have COVID and flu when you put them together into what could be called a twindemic. We were worried about that. But it's the flu is an airborne disease as well. Need to be remembering that last year people were taking precautions. They were trying to stay apart. People were wearing face masks a lot. They were protecting themselves. What happened with that? We didn't have the amount of flu that we had at all in the past. This year, we understand people were vaccinated. People were still trying to protect themselves, but they may not be taking quite the same precautions as they had in the past. So we recommend people get a flu vaccine. And for more information, please give us a call at the health department or get with your healthcare professional on that.
Andy, I've got just a couple of questions. Yes. How long apart can you have your flu vaccine and your booster shot? Can you have them?
Megan can answer that, but we're going to make it as simple as we can for people. Go right ahead.
Thank you, Mayor Hayes. So into that, flu vaccines can be co-administered at the same time with COVID vaccines. They have put out approval as research has went on, and we've done more and more of the COVID vaccines that they can be co-administered with other vaccines. So you can get them the same day, you can get them a week apart, you can get them a month apart. It's really just whichever you wish, but by all means, yes, we recommend both of those. I wanted to go in with what Andy was saying about the flu vaccines. We definitely recommend those. We are giving those now. We have the protocol at the health department for those. We are going to try to set up with the schools again this year. Me and Dr. Holman were just talking about that. We had a very successful turnout last year where we would go out to the schools like of an afternoon, maybe from 3 to 6, something like that. That way we can catch parents, students, faculty, staff, plus members of the community. That was a wonderful way, especially our elderly community members. They really like that because we came to those. So that's something to be looking forward to. You're probably going to see some advertisement about that. So by all means, come out and get your flu vaccines. And did you have another question before I moved into my other stuff?
No, ma'am, you answered my question. I just wanted to know if they can coexist at the same time. That was my question. And I think I didn't hear Mr. Langford say what percentage of Overton County has had at least one shot.
34%.
That's both. Let me get the 1%. 34% with one shot.
34% with one shot.
27% with
and 27% fully vaccinated.
yeah.
Thank you.
So, which, speaking of series, that's something I want to get into. Of course, at the health department, we have both Pfizer and Moderna vaccines. We do not have Johnson & Johnson. But with Pfizer and Moderna, there is a third dose and there is a booster dose. Okay, so a third dose is in addition to the primary series, and we're looking at that for immunocompromised individuals. So maybe their immune system's not working as well as it should, thus they need a third primary series to kind of bump that immunity up. So we do offer that, both Pfizer and Moderna. So that's immunocompromised individuals again, and for anyone that their doctor recommends it, okay? So we can go that route with that. And then there's also the booster dose that you've been hearing about, and that doesn't have to be an immunocompromised. That is more of a just, we know over time this immunity from the vaccine will wane, and this is just to boost everyone back up. So Pfizer has come out with their current recommendations, and Moderna will be soon to follow, but Pfizer's recommendations are anyone 65 and above, we want to go ahead and get a booster dose. The caveat is we want there to be 6 months between their second dose and this booster dose that they're going to get. And so I know this can be kind of confusing. So with a third dose, there only has to be 28 days between second dose and third dose, because that's a third dose primary series for immunocompromised and who their doctor recommends. Then we have booster dose, and that one is just, it's been long enough from your vaccine, we want to boost you back up, okay? So that's the way to think about that, and that's going to be 6 months from second to third, and that's Pfizer. We want anyone 65 and above to get that, and then really anyone 18 and older that has any sort of underlying medical condition, any sort of occupation that puts them at increased risk for exposure. So really just about anybody 18 and over is going to have criteria to get that booster vaccine. Again, Moderna has not come out with their timeline yet, but we expect that to follow in just a little bit. And we know there are several individuals that's went ahead and gotten a Moderna as maybe a third dose, that sort of thing. That is fine. That's good. That covers. So I just want them to be, rest assured. But if you have questions, like I said, it can be confusing. Just give us a call at the health department. But there is a difference between a third dose and a booster. So that's what we're looking at. If you don't really have a lot of health conditions, you're going to be more the booster route, and let's wait 6 months between that second one and third one. If we've got a lot of health conditions, our doctor's recommending it, we only have the 28 minimum day, and that's what we're shooting for, okay? So there's a lot on that one. If you get confused, just call us and we'll help, okay? Anybody questions? Thank you.
Thank you, Andy. Thank you, Megan. Just want to tell the community and everyone that is listening, Ben Danner and I join hands in saying, please get your vaccines. There was a lot of things coming up in this country, and festivals that we've still not made decisions on. Thanksgiving gatherings that will be coming up. Obviously, Halloween, Falloween, just around the corner that we haven't made any decisions on just yet. But with only 27% of Overton Countyans having at least one shot, that makes it a little bit more difficult on us to make these type of decisions. So I want to join everyone here, at least on this side of the panel for sure, to get your vaccinations. As far as the city of Livingston is concerned, we've not made any decisions yet on Halloween. We've not made any decisions yet on the Christmas parade, which, believe it or not, folks, is not that far away. But it would certainly be rewarding for us and make things a lot easier if we can get those numbers up as much as we possibly can, knowing that there's going to be crowds at these events. And some folks, unfortunately, are coming out even though they have contracted COVID-19. And that's a serious problem here with us from Overton County. In Overton County, we have, unfortunately, in the city world, as far as employment, we've had one of our officers that has lost a couple of loved ones, a wife and a mother, due to COVID-19. And if that doesn't open your eye up, then nothing will. And my heart bleeds out for the officer that lost family. So I just want to make sure that we're not having press conferences here because none of these folks have nothing to do today. That's not it at all. We're passionate about our community. We're passionate about Livingston and Overton County, and we want to do what's in the best interest of the folks that are in this community. And that's why we started this panel almost a year and a half ago, and it's been a very successful panel. And I want to thank everyone for taking time out of their schedules to do that. But that's just where we are at. My survey today with city employees, less than 50% are vaccinated. I'm looking at possibly giving bonuses to city employees that get their shots, and possibly if our numbers continue to go down as they are now with city employees being infected by the virus, then the folks that have not had their vaccine, may be tested weekly to try to keep a strong number of employees on the job. So that's where we stand. That's where I stand with this as far as the city's report is concerned. Now that's not in stone yet. I will continue to monitor this, and as we start having absenteeism due to COVID-19, then there's other measures that is got to be put in place. Thank you, Health Department, for your report. Next, Ms. Shannon Cantrell with the Overton County Livingston Chamber.
Thank you, Mayor. Going to report on our monthly unemployment rate and our sales tax collections for the month of August. Our unemployment has gone back down to 3.4% from 3.9% in July. So that puts us the lowest in the Upper Cumberland along with Smith County. Then on our sales tax revenue for Overton County for the month of August, this month last year, our sales tax revenue for the community was up 23.8%, which was pretty substantial at that time. This year, for the month of August, we are up again 15% more year over year. And annually, our sales tax revenue is up 24.1%. So all of that is definitely looking good for our community sales tax wise. People are shopping local. Tourism is continuing to grow in our area, and our small businesses are growing and thriving. Also, if you have a business in Overton County and you are still needing some COVID support, please give us a call at the chamber. We have resources available through some of our partners that we have at the chamber. So our number is 931-823-6421. Thank y'all.
Thank you, Ms. Cantrell. Next, we have Dr. Donnie Holman, Overton County Schools.
Thank you, Mayor Hayes. It's good to be here. Good to be part of this panel. The health department was talking about all their numbers, and our numbers look really good. I'm very thankful to say that from the school's perspective, our numbers look good. At this time, as of this morning, we had in the whole district, we had 18 students that were positive, and we have one staff member that's positive. So I'm very, very thankful that our numbers are as good as they are, and I really hope that trend continues and that they stay that way. I've had a few parents that have talked to me about how can we find out what the numbers are and how can we keep informed of that. So to keep the community informed of the COVID cases in our county school system, we had a link connected to our Overton County Schools website. And you can access that link, and there's all kinds of good information there, by the way, at www.oc-sd.com. There's where the link to the dashboard is. And there's really just two sections to that dashboard. The first number will tell you the number of students that are positive in our district, and the next number is the number of staff that's positive. And with staff, we're meaning teachers and the paraprofessionals, EAs, cooks, everyone. And that number is updated weekly. By every Tuesday morning is when that should be the most accurate, would be on Tuesday mornings from there on. The person that we have in the district that is working with those numbers is Jenny Smith. She's our coordinated school health supervisor. She keeps up with all of our COVID numbers and works with our nurses, and she updates our dashboard for us and sends all that information to Nashville. Very appreciative of her. Brent Thrasher is the coordinator that is over our IT department, and he's the one that helped us with this dashboard and linking it to our website. I'd like to say a thank you to him as well. We want as much transparency as we can have within the school system. We want the parents to feel at ease and be able to have answers to as many questions as they can. And I know when it pertains to student health, everyone is concerned, and that's why we wanted this link to be to where everyone could find it and could have access to this. And like I said, 18 students and 1 staff member as of this morning. So if anyone has any questions for me, you can give me a call, or I'm here to help in any way I can.
Thank you, Dr. Holman, I appreciate it. Thank you very much for being a part of this. Next, we'll have Overton County Executive, Mr. Ben Denner.
Thank you, Mayor Hayes, and I'd just like to, say I agree with Mayor Hayes. I think vaccines are the best tool we have to fight COVID. I myself have been vaccinated both times, got my flu shot today. I feel like, that's not 100% that it will get rid of every case, but I feel like for myself, that was the best that was out there. I feel like, when we're in school, we have to get vaccines in certain grades. Until we look at this vaccine like that, we're probably never going to be over COVID. I mean, this is a different time than it was back when these vaccines first come out. All of us, flu vaccine, we never really thought a lot about that every year until we get to thinking about the COVID vaccine like that. I think it's going to continue lingering on and on and on. So I've had so many people have family members pass away, and they told me, I wish we'd have got vaccinated. Maybe we made the wrong decision. We should have got vaccinated. I mean, that's sad to hear people say that. And, the family members, they could have passed away if they'd been vaccinated. Some people that have been vaccinated have passed away, but the numbers show that for the most part, people that's been vaccinated are not hospitalized nearly as much as people who aren't. So I'd just like to say I agree with Mayor Hayes. I hope, we never want to say we're not having events. We don't want to cancel Halloween. We don't want to cancel Christmas parade, but it makes it hard on us to make the decisions when there's only been 27% of the people in Overton County have both vaccines. We don't want to have an event that gets thousands of people together. And if you do the numbers, that's thousands of people that hadn't been vaccinated that could give that to other people. And we don't want to be the cause of anyone dying from anything, especially COVID. So just like to ask people, just think about that. And, I wish you would get your vaccine. As far as the county goes, we're not renting the Joey Levins Community Center or the Ag Building. We're going to look at it month per month and see what the COVID numbers are. I know the numbers have come down some, but it's still, the numbers are higher than they were last year. And last year, like Andy Langford said, people were social distancing from other people and they were staying apart. And now, of course, stuff's opened up, and I mean, there's, the NFL games, everything is open back up, it seems like. So, I guess numbers are going to fluctuate up and down, but once again, I feel like, and that's your choice, that's your personal choice if you want the vaccine or not. I don't see that we'll ever be in a situation where the county or the city mandates the people and the public to get vaccinated, but I feel like, I feel better myself about COVID since I've been vaccinated, and that peace of mind is worth a lot, especially the way things are in today's world. But thank Mayor Hayes for having this, and thank everybody that comes here. Another thing too with the vaccine, the people in our healthcare system, I mean, they're tired. They've been working for almost 2 years in this. I mean, they're seeing it every day. I mean, if just think about those people and your family members, and please get vaccinated. Thank you.
Thank you, Mr. Denner. Next we have is Mr. Tim McGill, Livingston Regional Hospital. Mr. McGill.
Thank you, Mayor Hayes. So to follow up what Ben was just talking about, at present we have 7 COVID inpatients in our hospital, 3 of those in our ICU. All service lines continue to be open here in our hospital, and we continue to admit patients. Our only limitations right now is visitation. We're allowing 1 visitor per day. One visitor during per patient during the hours of 7 to 5. Again, our goal is to restore visiting as soon as possible. I want to thank our LRH employees for their dedication and vigilance, coming to work every day. Work is not easy for direct patient caregivers. If you see them in their PPE going in a room with a patient that has COVID, it gives you a different perspective on what we're facing as a community, state, and nation. So, again, as Ben mentioned, healthcare workers are frontline protectors for each of us, and we want to encourage everyone to get the vaccine because it is the number one way to fight this disease that is so perilous. Again, thank you to our LRH employees. I appreciate every one of them and our physicians that are coming to work every day to take care of our patients and our community. And again, lastly, I want to encourage everyone to get the vaccine. It's readily available through our Overton County Health Department, most retail drugstores. It's free. It's very easy to do. I've had my series of vaccines, including my booster shot. My wife and I both have. Encourage you to do the same. Again, we thank everybody for listening in. Thank the mayor for arranging this monthly. Appreciate our fellow panel members for the good work they're doing in their workplaces to protect our community. Thank you.
Thank you, Mr. McGill, for being a part of this panel. Last but certainly not least, Mr. Scott Stevens from Overton County Health and Rehab. I think he's with us.
Thank you, Mayor Hayes. Yes, at Overton County Health and Rehab update, we continue to test all of our staff twice a week, and we screen each employee prior to them clocking in for their shift. In-person visitations are paused for right now. The exception would be for compassionate care cases. And we are scheduling virtual visits by calling Overton County Health and Rehab at 931-823-6403, and that's for virtual visits. And starting this week, Overton County Health and Rehab is now accepting new residents and patients to our new rehab center, as well as long-term residents for our Legacy House and Cottage. And that is our update from Overton County Health and Rehab. Thank you.
Thank you very much, Mr. Scott Stevens. Thank you very much. Keep up good work at the Health and Rehab. That concludes our meetings today for COVID-19. Our next one will be November the 1st at 12 noon. November the 1st at 12 noon will be our next COVID-19 update. That's all I have. Thank you for the panel. Thanks for everyone that participated today.